So, patient of mine with rheumatoid arthritis, symptomatically doing really well on her medication that she's been on for the last 2 years, controlling her condition well from a pain and function standpoint. She does have residual swelling in her right thumb, and she has concerns about whether that could be a sign of her RA still remaining active. So what's the approach to this clinical scenario? First and foremost, we do know that RA patients, even when their condition's under good control, can still have some degree of residual pain or swelling. It's my job as a rheumatologist to figure out whether or not that is chronic inflammation or if there's something else going on. The best and most efficient way that I know to really evaluate whether someone has active inflammation is the use of diagnostic musculoskeletal ultrasound. Physical examination is helpful to see if a joint is swollen and tender and warm, but it doesn't tell you exactly how much inflammation there is underneath the skin. MRI is great at looking for inflammation as well, but is not convenient to get done due to cost, as well as it can't be done while they're in the office. X-rays can be done in the office, but they're not exactly as helpful. They don't show actual inflammation. So diagnostic musculoskeletal ultrasound is the next test of choice. This is an ultrasound picture of the right thumb, the first MCP joint. What you see highlighted in red is evidence of thickening of the joint lining called synovial hypertrophy. This is different than having fluid in the joint. This is a chronic finding in rheumatoid arthritis, not an actively inflamed one. Highlighted in blue on this picture is a presence of an erosion. An erosion is chronic bone damage from rheumatoid arthritis. This is a sign of prior active disease. This does not show any active inflammation and thus does not show any active disease or active damage at this time. So based on her diagnostic musculoskeletal ultrasound findings at the hands, we can tell that she has chronic changes from her rheumatoid arthritis, namely prior irritation of the joint lining as well as an erosion from prior inflammation causing damage, but that there's no signs of active inflammation or ongoing active disease. So I can reassure her that she's doing well with treatment and will continue her current regimen, and that the residual swelling that she has in the thumb is not a sign of active disease, it's a sign of prior disease, and that based on her current ultrasound findings, as long as her condition stays at this level, the chance of her condition progressing or causing more damage is very low over the next 1 year. So in this case, ultrasound has been very helpful in telling us that her condition is well controlled and we do not need to escalate treatment for her rheumatoid arthritis. As long as she does not have pain or functional limitations, her current regimen is adequate. If she has any functional limitations, such as using her hand, then occupational therapy would be helpful. If she has some stiffness or soreness, then over-the-counter supplements would be useful. If she has more pains related to wear and tear and chronic damage in the joint and not active inflammation, then utilizing a treatment like platelet-rich plasma would be useful at this stage as well. Overall, a nice example of how ultrasound comes in handy on an everyday basis when it comes to treating inflammatory arthritis conditions, and how we utilize it to help us make treatment decisions as needed as well.